I'm Jack Cleland. I'm one of the pediatricians here at Medical Group of the Carolinas, Pediatrics North Grove. And I've been a pediatrician now for several years and do a lot of fun work with kids. And kids are a lot of fun, and what kid is not a kid without toys? So we're here today, we're gonna talk a little about some toy safety and some ideas that I have that I get a lot of questions over the years. I've seen a lot of accidents over the years. One of the biggest questions I get throughout the year is, what kind of toys can I get for my kids? What kind of things do they need? And the thing you gotta remember is toys have been around since the beginning of time. And toys are fun. They provide an atmosphere where kids can explore. And so toys are a very important nurturing aspect for a kid's development. The thing we have to remember as parents, though, is that toys also can be very dangerous. And especially in this day and age when toys are so prevalent, we got to know which toys are designed for which child at which age of life so that they can play, they can learn, and they can grow, but they can also be safe in the process. And when you look at a toy, one of the first things you ever want to look at is on the box, there'll be an age. It'll say indicated for ages 4 and up, 5 and up, 6 and up. Now, a lot of parents will come to me and say, well, my child can play with that, and they're not 4 years old. But what they don't realize is that marketing technique from the company has been on there for a reason. And what that company knows is that even though your child may be smart enough to play with that toy, there's something in that toy that they need to stay away from. Even though there's an age indication on there, I tell parents, you're still the parent, you gotta use common sense. Common sense always wins out, okay? So if the toy says age 10 and up, and your child is 10 years old, that doesn't mean that it's automatic. Well, it's safe for them, they can use it. You know, use some common sense. Your child may not be ready for that yet, okay? Or you may not have a place where they can safely play with the toy. So make sure if you have it, there's a place for them to do that. A lot of lead and toys have been recalled over the years. And when kids put things in their mouths, you know, whatever is on there, and lead used to be an ingredient in paint years ago. And unfortunately, we still see it depending on the country that they're made in. There's still a lot of lead available to be put in kids' toys. And it is not uncommon for us to hear about a lead recall. So when you get a toy, if there is a product registration card, one of the first things that I would tell you is to fill that out, send it in. And that way, if the company has something and they discover that there's something that's broken with their toy, they can get in touch with you, and so you can take that toy back immediately. Most toys, if they're recalled, they'll give you a full refund on it, or they'll replace it, or they'll fix it. Number two, when you're looking at toys, you want to watch for things that fly through the air. Now, I've got boys, and I love Nerf guns. It's probably one of my most favorite guns to play with in the house, and we have Nerf battles at our house. Again, watch for the age on there. Nerf guns are not for everybody. There's a certain age and up where they are allowed. These little bullets come out of here and they fly very fast, and they have a hard tip. Nerf usually will equip you with and tell you to make sure you're wearing goggles, and I would encourage you to do that, because if these things fly and they hit you in the eye, it will cause some damage. The other thing is choking hazards. Now, when you look at a lot of these little toys, they're all nice and neat and tied together in a package. But if you look, there's all these little tiny pieces everywhere. Number one, they're murder on your feet in the middle of the night when you're walking through the house. All right. Number two, though, if this thing can fit in someone's mouth, they could potentially swallow it. And I've seen kids do this, and they'll choke on it. A lot of parents will do, if they have older kids, and particularly if they have older and younger kids, you've got the big kid toys and the little kids living in that world with them. Some of the adults will choose to kind of take out some of the smaller pieces, kind of put them to the side. You can have this toy, but this is the toy that you're just going to play with in your bedroom. Or if it comes with 1,000 little pocketbooks and monkeys and fruits and cups and dishes, they don't necessarily need to play with all 1,000 pieces. Have a few pieces out for them, but then this way you don't have to worry about stuff being scattered all over the place. But in the event that something does happen, always call for help, right? The first and foremost is choking, because that is potentially deadly. 911 emergency room has got to be seen, especially if we've got a clogged airway and you look over and you see your child and they're not moving anything, no air is moving at all. That isn't an emergency. Many parents know how to do Heimlich maneuver. Obviously, that is the time when you'd want to start that. But definitely call 911 or get to an emergency room as quick as you can. The quicker that piece gets out, the better.